from DC line.
Hello, I'm Eric Corman, Communications Director at League of Education Voters. Welcome to our free online webinar series, Lunchtime LEVinars. We started this series 6 years ago to share information and build knowledge on important and timely issues. Today's webinar is about making early learning more affordable and accessible in Washington State. Two pieces of legislation introduced in the Washington State House and Senate would make early childcare and education more affordable and more accessible for Washington State families. The bipartisan Fair Start for Kids Act, also known as House Bill 2661, introduced by Representative Tana Senn, would reduce childcare copays, support childcare providers, and fund more childcare facilities. Senator Claire Wilson introduced the Early Care and Education Action, also known as Senate Bill 6253, which would create a comprehensive statewide early care and education system by improving accessibility and affordability of early care and education programs for families. Our speakers today are Representative Tana Senn and Senator Claire Wilson. They will describe how their legislation would improve early childhood education in Washington State, and they'll also answer your questions. Senator Wilson has been called into fiscal caucus, and she will join as soon as she can. As a working mom with 2 kids, Representative Tana Senn brings an important perspective to legislative issues. She consistently advocates for busy families through policies that address education and community needs, and seeks upstream solutions to prevent crises before they occur. As a state representative for the 41st Legislative District, Tana chairs the Human Services and Early Learning Committee and sits on the Local Government Committee and the Appropriations Committee. Tana has championed legislation to close the gender pay gap and ensure our children have access to mental health services and social emotional learning in our schools. Tana also serves as co-chair of the Oversight Board for the newly created Department of Children, Youth, and Family Services. After earning a master's degree in public policy and administration from Columbia University, Tana worked for 15 years in government relations and communications in the private, nonprofit, and philanthropic sectors before her tenure on the Mercer Island City Council. Tana serves on the board of HopeLink and the National Association of Jewish Legislators, as well as on the advisory board of the UW Masters of Applied Child and Adolescent Psychology program. She has held previous board roles on the National Breast Cancer Coalition, the Jewish Federation of Greater Seattle, Mercer Island Youth and Family Services Foundation, and the Island Park Elementary School PTA. Tana, her husband, 2 children, and their big black lab live on Mercer Island. I'll save the introduction for Senator Wilson when she joins. Here's a couple of housekeeping items before we begin. You'll notice a Q&A function at the bottom of your screen. This is a space for you to submit questions to us. As always, feel free to send any feedback about the webinar quality to us on the chat function or at info@educationvoters.org. Welcome, Representative Senn. The floor is yours.
Thank you so much, Eric, and to everyone listening. I am thrilled to be joining you today. It's quite an honor. And I'm thrilled that we are talking about early learning and childcare, because from the national level, whether you're paying attention to any of the candidates or you are just somebody out in the community working and trying to manage your family, you know that childcare and early learning are huge issues before us right now. So as Eric mentioned, I am the chair of the Human Services and Early Learning, and so I have been able to really focus in, especially this year, on the issues of early learning and childcare, and spent the interim between last session and this session traveling around the state, meeting with and speaking with childcare providers and parents and family homes and ECAP providers all about the needs of early learning and childcare and how we can really make a dent in them. And that has really helped inform the legislation that you guys are focused on today. But just a little bit more on a personal note, I remember when my kids were little and I was working part-time. I was working 4 days a week so that I could have an extra day with my son, and I could not find childcare that fit our needs. And it was really challenging. And there seemed to be either a part day, 3 hours a day, every day, or you had to go full time. And that was just not going to fit our budget and our time frame. And so I recall those challenges, but I was very lucky because I was also looking for childcare that I knew in general I could afford. And that's not the situation for a lot of families. But it is something that I feel like I can feel in my gut. And I remember visiting the different childcare providers, and some places were just not somewhere I wanted to leave my child. And so also knowing how important that high quality childcare is when we talk about that. So kind of with those things in mind, it has been an honor and a thrill to really focus in on childcare and early learning this session in particular. What we also heard this fall were about a couple of reports that came out that were really compelling and telling and have helped inform the conversation as well. And that was around the mounting costs of childcare. And in that report, it was came out and was done in conjunction with the Association of Washington Businesses and the Department of Commerce. And that really put a lens for the business community onto childcare. And it talked about businesses losing $2 billion a year just in the Washington state economy alone from the lack of childcare for their employees, and $6.5 billion for the economy overall. From the lack of childcare. And so that really also helped elevate the conversation to bring it to the business level and to bring in partners that we don't necessarily normally think of when we talk about childcare and early learning. But so we've had an amazing coalition this legislative session and in developing the Fair Start for Kids Act, which really seeks to make sure that we have childcare that is accessible and affordable. That we can expand childcare by supporting working families and making sure that, again, it's accessible and affordable to them. But we also have to support the actual workers, making sure that they have good pay and health care so that we can recruit more to the field and keep people in the field, because we know there's been a 43% year-to-year turnover in early learning. We need to expand the actual physical facility capacity to make sure that if we're going to have more kids and more childcare, we need more places for them to be. And then we can't forget about 0 to 3 services. And not every family is going to put their child in childcare, and we want to make sure that parents are supported with good parent education supports, and play and learn groups, and other things that really help them continue to be their child's first teacher. So with that, the Fair Start for Kids Act was developed, and again, really focused on making sure that we had accessible and affordable childcare. We were supporting the early learning childcare industry and supporting 0 to 3 services. So it has a number of components in it that really, again, what we've seen over the years and what early learning and childcare needs, but also what we heard directly from parents and directly from providers are the biggest issues of concern. So as probably most people know, Washington State subsidizes childcare through the Working Connections Childcare Program. And that's a program with federal dollars that comes into our state to help working families with childcare. And we also match that with some state dollars. But the rates that we pay for Working Connections are lower than what it would cost for a private family. And so it makes it even more challenging for a family with that subsidy to go out and find childcare, because not every childcare is going to necessarily want to accept that subsidy rate, which is, again, lower than the private market. And that also means it's harder for childcare businesses to stay afloat if they are taking families with subsidy, because they're losing out on additional dollars they could be getting from the private market. So it was really incumbent on us as a state, the state level, to increase those rates and make sure that we are allowing families to find that childcare, because even if they qualify and then they can't find childcare, that means they can't take a job. That means they can't maybe take a raise or increased hours and go full time, again, like was one of my challenges. And so we really needed to fix that part of Working Connections. And similarly for ECAP, which is the state's preschool program for lower income families, that similarly had issues around rate structure, not paying the true costs of what it takes to take care of our kids, and we needed to really increase that as well. So for accessible and affordable, we focus on increasing rates, and again, making sure that for families who do get a Working Connections childcare subsidy, as they proceed along in their career and they make more money at their job, they then have to pay additional copays or more out of pocket for themselves for that childcare. But what we've seen is that as people make more money, even just a few cents an hour more, their copays have just gone up dramatically. And that results in people losing their childcare because they can't afford it, or having to decline a promotion or a raise. And that isn't what we want, and that's not good for economic stability or for the economy. And that's, again, a lot of what the business community saw as ways that they were losing money. So a big part of the Fair Start for Kids Act is also buying down, is how we call it, buying down those copays, so families can take that promotion, can keep progressing at their job, and make sure their children can maintain their high-quality childcare. So that's a huge portion of Fair Start for Kids Act, is that focus on accessibility and affordability. The second component was focusing on that workforce and supply side. And again, with those low reimbursement rates, that also translate to low pay for childcare providers. And as I mentioned, with a 43% turnover in childcare providers, that really hurts our kids who are in childcare, and as their brains are developing and as they're learning social emotional learning, we want them to attach to adults. We want them to have that bond. We want them to have stability in their lives, especially for kids and families where their parents might be working multiple jobs, or they've experienced trauma, homelessness, or an incarcerated parent, or loss from a fire in their district. We want to make sure that they have a safe place with high quality interactions and with a consistent adult in the room, and so that turnover is really not good for the kids and not good for the industry. So we need to pay providers more. I'm sure that resonates with any provider who might be listening. We also have really important requirements for professional development, because we want that to be high quality. But another place where the state has not stepped up as much as they need to is around scholarships, and actually providing that opportunity in the communities for people to get that professional development that they need, and probably also in the language that they need. We have a really diverse early learning field and workforce, which is fabulous. So many industries are trying to diversify their workforce. And here we are in early learning, we have the diverse workforce. We need to make sure we keep it. We need to make sure we celebrate it and that we support it. So professional development is a key part, with scholarships, a key part of the Fair Start for Kids Act. Another thing that I heard as I was traveling around the state that I was pretty surprised about is that probably around 85% of people who work in early learning don't have health care. And when we think about, when the school year starts and your kids go back to school, usually kids get sick, parents get sick, right? You all know it's just this kind of thing that happens in September. But think about for childcare providers who are around little kids with the sniffles all year long, and they themselves don't have health care. That's just unconscionable. So the Fair Start for Kids Act directs the department and the Healthcare Authority to work with childcare providers to help them get health care on the exchange if they can, to work with other health insurance, whether if you're part of SEIU in a family home, to really make sure that we expand the pool and accessibility for health care, and make sure that as we move out with and understand the true costs of childcare and then fund that includes health care, because that's really critical. And then just a few other things that I'll touch on. There's lots of details in the bill, but things that I think people might be interested in knowing about is the emphasis on mental health consultation for childcare. So So much of what we've heard when I've been traveling around the state and hear from parents and providers is this need for mental health. Unfortunately, again, kids going through trauma or just behavioral issues or just kids being kids, we need to make sure our providers have the tools they need to manage the classroom, to help our students, and to help the families as well with important mental health tools. And also make sure that they're taking care of themselves, especially when we're not paying them that much and we expect so much from them. We really want to make sure that they're in a good mental health space and they're not overworking themselves or getting so stressed that they can't be present for their kids and for their own families. So that mental health consultation is critical. And then the other piece that the other quick pieces that I'll mention is around, again, back to that equity piece, making sure that we fund and we support dual language programs. And again, celebrating that diversity of our state. Forgive me if my numbers aren't exactly correct, but I think that about 50% of the kids coming into childcare and kindergarten right now in Washington State are kids of color. And a lot of those speak a different home language than English. And I mean, we have a global economy, right? Washington State is this amazing trade partner with all parts of the world. And I represent Bellevue, whose motto is, we welcome the world, diversity is our strength. And we want to be able to celebrate that and support that. So funding dual language programs in childcare is really important. And trying to keep those people who do speak two languages and who are skilled at teaching bilingually, we need to also pay them more to celebrate that skill and not just expect somebody with a great skill to stick around out of the goodness of their heart, but really to pay them for their skills and their quality. And similarly around mental health and around awareness of trauma. We really want to make sure that kids have access to people and an environment that is trauma-informed. And so we create a dual language designation and a trauma-informed care designation that will also have additional funding. And then lastly in that space, the Early Learning Facilities Fund. So we just released about $17 million in grants to childcare facilities across the state because we want to expand and we want to support them. And we really need to continue that investment and expand it. So I will just quickly touch on that last topic of 0 to 3 and then would love to open it up for questions. So in that 0 to 3 space, we know that infant and toddler care is the most expensive of childcare, and so we need to make sure that we're providing even more incentives, and that usually means dollars, to providers to provide infant and toddler care, because we know in lots of parts of the state there just isn't any to be had. I often mention that if you are excited about your pregnancy or adoption on the horizon, and then you just learn that you can have the state's new family leave policy, paid family leave, you are good to go. You're all excited, got a few months off, and you know you're going to go back to work in a few months. And then, oops, you didn't get on that wait list. If you haven't already secured that childcare, you are going to be pretty surprised and in a tough situation. And so just thinking about that and the really need for infant and toddler care. And then again, around other supports for parents with parent education are things that we need to support parents or grandparents or a loving family member, a friend, family friend and neighbor with some great skills that will keep our children learning in that early age before they get to kindergarten. Because being ready for kindergarten is critical to success in the rest of their education, career, and life.
Great. Well, thank you very much, Representative Senn. I really appreciate that. We have about 10 minutes for questions, so I'll go ahead and put up our question slide. And no question is too basic. All you need to do is type in your question in the Q&A box at the bottom of your screen. And it turns out we have a couple of questions already, Representative Senn. Let's go ahead and start with this. Thank you for your support of early childhood education. How do you foresee providers accessing healthcare when those receiving 16 plus an hour, in other words, $16 an hour or more, are over the income guidelines to qualify for Apple Health?
That's a key question. We know, unfortunately, that too many of our providers are on public assistance, which, again, I think is a burden on the state that we have not paid people enough. Through the health exchange, we are looking to work with providers to see what subsidies that they could get from the federal government, because as your income increases, you can also buy down some of the costs of healthcare. Again, still really, really high. But ultimately, that's kind of a stopgap measure. Ultimately, what we have been tasking a committee to do, the Childcare Collaborative Task Force, is to look at what is the true cost of quality. As you might know, right now when we decide how much the state is going to subsidize or pay for subsidized childcare, we look at the market rate. And then the state is right now paying about 55% of the market rate to providers. Well, the market rate doesn't necessarily mean that's the rate of what it costs and what the industry needs. That's just what the market currently is able to bear. So we're doing a report that looks at the true cost of quality childcare, and not just the market rate, but at the actual true cost. And within that, we are saying it needs to include healthcare. And so when we get that report, hopefully we'll be able to dramatically shift how we push out money into the community to providers, and make sure that that rate includes enough money for providers to get healthcare.
Great, thank you very much. The next question I have is, are you in support of fully funding community-based pathways?
I am. Thank you for that question. So community-based pathways is really a great idea that has been kicking around for a little bit to make sure that providers can get the professional development that they need closer to home in their own communities, not having to go to a community college or necessarily go online, but have a little bit more flexibility to either learn in a cohort model with other providers, maybe even having that education provided at their childcare center, maybe in a different language if that is the most helpful to their needs and their community's needs. And again, to bring that education closer to home. We've heard from providers that the idea of going back to college is really intimidating as well. Whether you're a younger provider or an older provider, you might have been out of school for a really long time, or maybe school wasn't your favorite thing. And so we want people to get the skills and the education they need closer to home at a more affordable rate, in a language that's accessible and without the intimidation. So the community-based pathways is a critical component to that.
Great, thank you very much. Once again, if you have questions, you can type them in the Q&A function at the bottom of your screen. Here's another question, which is, there are set dollars for ECAP, but none of it for providers in the Act. It states based on availability. How do you propose fully funding Working Connections childcare?
So again, thanks for that question. So again, kind of going back to that cost of quality model, one of the things that when we put together a policy, we really want to make sure that it's lasting and that it has a good vision for where we want to go. And so we have kind of some stopgap measures in the bill to get us through the next few years until we have that cost of quality model available which is a long-term project that we're working on. And at that point, we will then be able to find out and understand the true cost of quality and then make those direct investments there. Another reason why we don't have any specific numbers or things like that in the actual wording of the bill is because we wanted to see what we were going to be able to do this session. And I am thrilled to report to you all that in the House budget that we just passed out of committee yesterday and we're going to pass off the floor tomorrow, we have huge investments in childcare and early learning. In fact, it was the #2 issue in our budget, right after homelessness and housing. And we are proposing to invest dollars into childcare that bring Working Connections childcare rates up to the 75th percentile. We have a 7% increase for ECAP, in addition to a $2 million pool for special needs in ECAP. We also have money, about $7 million, to address the scholarship backlog, to fund the community-based pathways and make sure there's enough scholarships to get people through those community-based pathways. In addition to a number of other investments, like helping buy down those copays for families, as I was mentioning before, and some additional investments into the Early Learning Facilities Fund. So I am thrilled with the House investments. The Senate is also making some important investments, a little bit less than the House. So we're going to be fighting real hard to make sure that the end result is as much as we can focused on fully getting providers up to that 75th percentile of market rate.
Great, thank you very much. We have time for about 3 more questions. And I have one here, which is, are you in favor of funding the career and wage ladder again?
So the career and wage ladder was something that went into law about, and again, it's approximate, about 10 years ago, maybe 15 years ago. That was a way to make sure that as people progressed in their education and in their experience, that they would get designated bumps in pay. And that was a great idea. And childcare centers would have to opt into the career and wage ladder system, guaranteeing that those increases would be there, and then the state would help with them. It was also a little bit connected to the K-12 market and some other contexts. So that hasn't been funded by the legislature for a number of years now. And so I think the concepts in there, again, of making sure that we pay people as they get more education, like I was mentioning with their dual language certification or trauma-informed care skills, we want to make sure we're paying people more. While we want to really support those concepts in the career and wage ladder, I think right now we'd have to go back and reset the actual mechanics and the baselines for the career and wage ladder. And I think it would take a little bit too long to do that and then roll it out. So right now I've been focusing on those childcare rates, getting the dollars out the door right now, because we're in a childcare crisis. And we can't wait 9 months or a year to be able to get that money out, and just to a few centers that adopt it. We need to get dollars out right now to childcare providers, frankly, at level 2, which is the base level, the entry level for childcare, so we can attract more people, more providers into the field, so they will continue in their growth of high quality, but get them in, make sure they recognize that we value their work, we value childcare, and we're gonna pay for that quality and that value.
Great, thank you very much. I have a 2-part question for you, which is, why as a society do you think that we don't value childcare in general? And ideally, what should we be paying our childcare workers in terms of salary?
Just those kind of easy questions, small questions. So why don't we value childcare? You know, I don't know, but I certainly know that in a lot of the things that I work on, I've been really focused on equal pay. That was one of my first large policy efforts in the legislature. You know, unfortunately, sometimes we still see certain fields as women's work, and something that we want, the family should really just be doing this. Why don't people just, you know, take care of their kids or leave them with grandma or something like that? And there's a couple, really, I think, 2 huge things that have changed. One is that our understanding of brain development. And we now know that our brains, kids' brains develop about 85% just in the first few years of life. And so if we are missing the mark, if we aren't teaching those social emotional learning skills, we aren't having dynamic interactions with kids, they have less brain development, and that's going to last with them the rest of their life. So we really need to address that early. And make sure they're getting those early learning years of really high quality interactions. And so that's kind of new knowledge that we have. The other thing is, truly we have a changed economy. Both parents are out of the home working in most cases. We have so much more travel and people moving in different parts of the state or the world or the city, that extended family is not nearly as close by. And so we are kind of slow to get to the uptake in investing and seeing the value of childcare and of early learning, but we do know it's the best investment we can make, both like literally for children, but also financially. So kids have less special ed needs. They are more likely to graduate from school on time, more productive in society. And so all of those have prevention costs, which again, as you said in my bio, I really focus on those upstream investments. And let's get those kids the resiliency and the strength that they need to also reduce mental health needs in the future as well.
Great, thank you. And so would you say that it would be important for the industry to basically pay their workers a living wage, a family wage, a career wage versus what they're getting now?
Thank you. That was the second question I had forgotten it. I mean, paying the childcare providers is critical, but I guess yes, but it's not that I think providers are not paying their workers as much. It is a little bit of a broken market. Childcare providers can't charge more to families because they just can't afford to pay anymore. And similarly, with rising minimum wage and the costs of just living, whether it's rent or mortgage costs, gas, food, everything going up, there's also providers need to make more. And so we're getting to this kind of squish point where it's really hard to make ends meet, both for the business and for families to afford childcare. And that's where I really think government needs to step in. And we need to be subsidizing. We need to be addressing and helping on the professional development side so people don't have student loans, so they can get into the market and that they can see a pathway forward. And so that is something that I think our state is grappling with. And it's not just a Washington state problem. This is happening all over the country. You'll see different presidential candidates have come out with childcare plans because this is really a crisis across our nation. And I think it's going to take a little bit of a realigning in the way we think of government's role and the role of childcare, because it is critical for brain development for children. It's critical for our economy and businesses, and it's critical for working families.
Great, thank you very much. Representative Senn, do you have time for 2 more questions?
Sure.
Okay, first one. This is a little bit more in the weeds now that we've been at the 30,000 foot level. So we are really worried, and I assume this comes from a provider, we're really worried about the new background check requirements. And DCYF needs more staff to make it easier for us to not be out of compliance when onboarding new staff. What do you see as a pathway forward?
Yes, thank you for that question. I really heard that all around in my travels, that there's this backlog of in background checks. And, we want to make sure that people who are interacting with our kids are safe. But we also know that we need to get people in the classroom right away so that we can serve more children. So we have proposed in the budget right now, there's a great investment in the Senate budget that just last night we were talking about in the House, and we know when we get to conference between the 2 budgets, it's something we want to keep in there to provide DCYF with more dollars, more people to help with those background checks. This is in the weeds question. I don't want to get too in the weeds, but background checks involve a lot of departments, FBI, the Washington State Patrol. And so we have to really look, frankly, overall in the coming years as a state of how we're going to address background check issues, because it's not just an issue for childcare, but it is for behavioral rehabilitation, foster care, for teachers, for supportive living, assisted living, all of these human services arenas. And so as a state, we really are going to have to address this issue. But in the meantime, rest assured, we are working on it. I apologize in advance if we don't get it quite far enough, but the alarm has been raised and people know that we need to be addressing this issue.
Great, thank you very much. And the very last question is, what are your plans for the Fair Start for Kids Act in the next session, the 2021 session that is, and beyond?
Thank you for that. So the Fair Start for Kids Act was just, such a bold statement this year in an off-year budget cycle. And so it has gotten so much attention. I think almost every single member of the House Democrat sign on to the bill and a Republican. So it was a bipartisan piece of legislation to really emphasize and show how important childcare is. Again, with the budgets, we are making a huge step forward in major investments around childcare and as I say, to really have stabilized the market. And then next year, we need to continue to make sure that it's more accessible and affordable for families. So I will be back. There's some really important policy in the bill as well that we need to keep working on, but we have made significant strides this year, and there's some great policy changes that are coming our way as well. So thank you so much for having me. I'm getting the hook to head off to my next meeting, but really appreciate you guys inviting me. And I would be remiss if I didn't say it's been amazing to work with Senator Wilson as well, who couldn't join us today, but has definitely been a bicameral effort. She is also a champion who's worked in ECAP for many, many years and early learning for many, many years. And so it's wonderful to have such a strong team here in the legislature. And to all of you. Yeah.
Well, I really appreciate your time, Representative Senn, and appreciate all the wonderful work you've been doing on behalf of our kids.
Thank you so much. Bye, everyone.
And thank you for joining. Our next webinar is a wrap-up of the 2020 legislative session, scheduled for Tuesday, March 17th at 12:30 p.m. We will include a registration link in the follow-up email that we'll be sending tomorrow, and we will post the information on our website and our Facebook page. Thanks to each of you for joining us today. If you have additional questions or comments, please send them to eric@educationvoters.org, and that's spelled ARIK@educationvoters.org. A recording of today's presentation will be available on our website, educationvoters.org, and feel free to share it with your friends and colleagues. If you would like to learn more about League of Education Voters or support our work, please visit our website, educationvoters.org. Thank you again for attending, and we hope you'll join us at future webinars.